All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. This is Jasila Mujib welcoming you to a brand new episode of BNC Global Live Al Hilal Health World, nothing but lifestyle. Today we will be discussing about oral cancer, its causes and concerns. Oral cancer, is a cancer affecting the tissues of the mouth, and if left untreated may lead to many complications. And we are delighted to have with us Dr. Karis Chandi Joseph from Al Hilal Hospital, Adaliya. He is a specialist in oral medicine with an experience of more than 18 years. So without losing time, let's move on to the doctor. So doctor, welcome to the show.
Thank you so much. I'm glad to be here.
Yeah.
Greetings to you.
Thank you, doctor. So doctor, you are an oral physician. Our viewers would like to know more about oral cancer from you, and how do you describe oral cancer?
Okay. So let me just tell you a small an experience I had.
Sure.
Not very far off, maybe around 2.5 years back, I had a patient who came to me. She was a lady. She was 35 years old, and she came to me with just a very mild symptom of burning in the tongue. That is the only consideration she has. And when I asked her in detail, she told me since 8 months she's been having this problem. It comes, it goes. So she never had any problem with it, and she was not upset of it. But she just wanted to show me, just in case, to see what's going on, because burning is not normal. So she wanted to show me. When I saw it, all the red flags started coming up in my mind. I immediately posted her. I told her that tests have to be done. I diagnosed what it could be. I did the tests, and sadly, it came out to be oral cancer.
Okay.
Now, the minute I diagnosed it, I told her treatment has to be done. She immediately went back to India. She did the treatment for oral cancer, but I'm very remorseful to say that she's no more now. That is how dangerous oral cancer can be. Oral cancer has to be prevented. So knowing more about oral cancer is very important. So let's get into oral cancer. What would you like to know about oral cancer?
I would like to know about all the causes, symptoms, everything about oral cancer for our viewers. So first we will start with how common is it now?
How common? Yes. There is a World Cancer Observatory. They record around 380,000 new cases of oral cancer a year. 380,000 new cases. It's not a small number, especially if we are one of those 380,000 new cases. So, what causes cancer? Many people, the first thing that comes into their mind is, I don't smoke, I don't use tobacco, oral cancer has nothing to do with me. That's what 90% of the people think. But yes, tobacco, whether you are a cigarette smoker, a pan chewer, or you use pan masala, or you even vape, these are definitely directly related to cancer and should not be done under any cost. You should be avoiding it at any cost. But along with this that you already know, there are other causes that can also cause oral cancer. So the most important is, for any measure, is cigarette smoking. Number 2 is alcohol. And number 3 is pan masalas. So cigarette smoking, pan masalas, and alcohol are the worst 3 things that you can do to yourself and cause cancer yourself. The rest of the factors are not under your control, but at least these 3 things are under your control. But most important, along with all of them, is the importance of getting yourself checked every 6 months. Because you know the number of cases I've seen, young ladies who don't smoke, young middle-aged ladies who have no history of smoking, using pan masala or alcohol for that matter. One sharp tooth, one broken tooth is enough to cause oral cancer. How could you imagine one broken tooth can cause oral cancer? But sadly, yes. Irritation from one broken tooth constantly at one particular area causes chronic trauma, and that itself can lead to cancer. Have you heard of cervical cancer? Nowadays, gynecologists are doing a campaign to inform the general public, especially young women, that there is a virus called human papilloma virus that causes cervical cancer. The same thing applies to the mouth. Oral cancer, there are genealogies of oral cancer. There are types of oral cancer that are caused by the human papilloma virus. Oral and pharyngeal cancer caused by human papilloma viruses. So the same vaccines you're taking to prevent cervical cancer actually prevents against these mouth cancers as well.
Oh, that's good.
Right? Human papilloma virus, smoking, any irritations from the broken down tooth, And even skin disorders, long-term chronic inflammation, skin problems that are affecting your skin can appear in the mouth, and those lesions can also malignantly transform into oral cancer. I've seen cases where a disease called lichen planus, which is primarily of the skin, I've seen cases where those have turned into malignant cancers of the body. So these are a few causes that I've seen. These are risk factors that you should avoid. See, the only thing you can do with regards to the other factors is to go and meet a dental professional who has training in this. And in Bahrain, you have so many dental professionals, they will refer the case to me for final diagnosis. But it's your job to go to them. How can they come to you? It's not possible. The onus is on you to go to them every 6 months, check yourself up. You have to self-examine. Do you have any problem other than, not problem, you have to see, are there red spots? Some of the signs that these patients tell you, what are the warning signs? If you ask me what are the warning signs, some of the signs that cancer come as is redness.
In the mouth.
In the mouth.
Okay.
It could be on the cheeks. It could be on the tongue. You can have small blisters breaking up into ulcers. You can have white spots. You can have dark, melanin colored dark spots with whiteness and interspersed redness. So the minute you see something abnormal in your mouth, please visit your doctor. Tests will be done at a timely interval. It will be done before the problem gets worse, and early diagnosis is the only way to fight against this particular problem.
So doctor, now you mentioned about the causes and risk factors. We would like to know about the symptoms of oral cancer now, and what are the warning signs we should look forward to?
Yes, very important. Okay, so for a patient, what will you come to me for? That's what you're asking, yes? You may not have anything very particular, or you will not have a problem. You may just have a small burning sensation on the tongue, or a small area of redness on the tongue, on the lips, on the floor of the mouth, in places inside on the top of the palate. These are places where oral cancer can come. The tongue is the most aggressive place, and that is from where the cancer can spread fast. So if you have small blisters that are not healing for at least 4 weeks, it is not healing within 4 weeks, then it is high time that you're supposed to see a doctor. So even if it's 2 weeks, you better come and see us. But if it's definitely more than 4 weeks, then definitely come and see us. Redness, white lesions in the mouth, red and white interspersed together, black lesions with whiteness in the area, and non-healing ulcers.
Inside the mouth.
Inside the mouth.
Anywhere inside.
Anywhere inside the mouth. Non-healing ulcers, you have to come and meet us. Cancer doesn't have one particular form. Cancer is just a transformation. Whatever you have can get transformed to cancer. So it's mighty imperative that you come at the right time to come and show us. So redness, whiteness, any burning sensation, you may not have any pain for that matter, any ulcer that is not healing for 2 to 4 weeks. All these are warning signs, red flags that you need to consider and go to a doctor immediately. These are some warning signs of cancer.
Is pain an important sign? Is pain an important symptom of cancer?
Pain may come along with cancer or may not come. Pain is definitely a factor in the later stages of cancer. But initially, pain comes due to an infection, a secondary infection. These cancer lesions can get infected. So pain may become a feature, but 90% of cases, the patient does not even know That is why they come late to us. So the answer is generally no. Pain is not associated with early stages of cancer. So do not wait till you get pain to come and visit us. Please come early. That is the takeaway message.
So, doctor, how do you diagnose oral cancer? Most of us are not in the habit of watching the signs and symptoms inside the mouth. So, how can we diagnose?
So, first thing is, if ever when you are brushing, you should make it a point to just look into your mouth. Generally, what do? We get up from our sleep, go to the bathroom, stand in front of the mirror, fast, we brush and we finish the job, right? It's a job to do. But no, you have to pay a little bit of attention. You have to brush your teeth properly in the manner it is to be brushed. And afterwards, just have a look. If you see something abnormal, come and meet us immediately. That is the most important thing. So number one is self-inspection. If you find something, you come and meet us immediately. Then when you come to us, we have a few protocols that we use. In my practice, I use some dyes to diagnose. I have certain methods of diagnosing it. The final way of diagnosing is by taking a small piece from that area and sending it for laboratory examination. The process is called an incisional biopsy. That is the confirmatory test. But generally, even before that, just by inspection and doing mild tests, we have even a latest advancement called Wellscope. We have an instrument to see the fluorescence of the lesion and diagnose this particular problem. So in the end, we have to confirm it by sending it to the lab. Just take a small piece of it and send it to the lab for testing. That gives us a confirmed diagnosis whether it is cancer or not.
Do we have this facility in Bahrain?
Diagnosis, definitely. But then the golden standard that has come in terms of cancer treatment is to finally do something called a PET CT scan. A PET CT scan is a combination of functional and anatomical imaging, and it tells us whether this particular problem is only localized here or whether it has spread. From here, the cancer can spread through your lymph nodes. It can go to the whole body. So it's very important to first analyze where all it has spread. The treatment has to be planned in that manner, and then the treatment has to be done. So for the diagnosis sake, you have to do something called a PET CT scan. That is not available here. There are centers in India. In Bangalore, there's a center called HCG. That is a center where this PET FDG scan is done. The PET CT scan is done. That gives us a final picture of how bad the problem is, and the treatment should be taken up accordingly.
Okay, now if a person is diagnosed with oral cancer, what are the treatment options?
The primary treatment for it is surgery. Surgery is the primary treatment for it. But the treatment planning is a very, very long procedure that involves radiation. You have to consider surgery, radiation therapy, and chemotherapy, and even there are new advances called immunotherapy. Specifically, the cancer cells are attacked. Now, all these treatments can be done in specific cancer centers. In Kerala, RCC is one of the best known cancer centers. In the Malabar region, there is Malabar Cancer Center. In Karnataka, there is Bangalore Baptist Hospital. There is Kidwai Cancer Center. And there is this HCG center known all over the world for treating cancer. So these are few centers in South India that do the treatment for oral cancer. The treatment primarily is surgery. There is no treatment without surgery. Then immunotherapy and chemotherapy or radiotherapy is used as an adjunct to this particular surgery.
Now, doctor, can we prevent this type of cancer? What is your suggestion?
That is a very good question, because the treatment and once it is diagnosed, then the treatment is very, it is a huge financial burden and it is very cumbersome. It's about relocating yourself. You have to go through the surgery, you have to do the chemotherapy, you have to do the radiotherapy, you have all the side effects of all this treatment. The first thing is prevention. See, when you come to us early, there is a term called pre-malignant disease or pre-malignant disorder. Before malignancy is reached, there is a stage where we can identify the problem and we can give you antioxidants. They are multivitamins and medicines that prevent oxidative stress and prevent cancer from developing. We can try everything to maintain you in this particular phase before it reaches cancer. So prevention is the first line of attack. Instead of going for trying to cure cancer, you have to try to prevent cancer. So much of knowledge has come into the field. So if you do your due diligence, you just come to us at the right time, we can do a lot of treatment for you. We can try to prevent this problem for you. We give you counseling, we give you education, we give you medicines to counteract the problem. Once it is cancer, all this has to be skipped. Then it is radical treatment from that stage onwards.
Does heredity play a role in this oral cancer?
Definitely, yes. See, when we talk about the cause of cancer, because of lack of time, I didn't explain everything. There are genetic factors, there are epigenetic factors. The genetic factors is how our DNA responds to this. There are something called tumor suppressor genes in our body. Our body has a natural defense against cancer. When those defenses are suppressed, then you end up getting cancer. So a genetic predisposition is there. Then the environmental factors and the epigenetic factors act together like a roller coaster and finally cause cancer. So definitely genetics has to play a role in cancer.
And finally, doctor, what is your message for our viewers?
My takeaway message is this: prevention is better than cure. Go to your practitioner, make sure twice a year, the periodic follow-up is twice a year. Dentistry is not costly nowadays. Go to your dental practitioner, make sure you do a screening with regards to oral cancer. Even with regards to the dental health, I just want to put across a term to you. It's called a microbiome. Okay? There are good bacteria and bad bacteria in your mouth, and they are in a constant state of balance. Good oral health means the good bacteria are more than the bad bacteria. So it is your duty to maintain hygiene. It is your duty to go and visit the doctor at the right intervals so as to deliver good health to you. It is your duty to maintain the health of your body by maintaining the health of the mouth. It's no longer this is separate. This is attached to this and this controls this. For me, this controls this.
The whole body.
Yes, you have to take the onus of keeping yourself healthy by keeping your oral biome healthy.
And doctor, finally, before we wind up,
yes,
what do you have to say about Al Hilal Healthcare?
Al Hilal Healthcare. Al Hilal is one of the fastest growing healthcare networks in Bahrain now. You all have witnessed that. Now, with regards to the dental treatment, we are the sole providers where you will get all specialists of all speciality in dentistry. We have a good prosthodontist who is an artificial teeth specialist. You have 3 endodontists in Al Hilal. You have a pediatric dentist in Al Hilal. You have 2 surgeons in Al Hilal. You have a gum specialist and implant specialist in Al Hilal. Anything related to dentistry, you have the combined a list of dedicated professionals at your service trying to better the dental care of the community. Al Hilal has shown great leadership in that particular manner. The wholesome care has been included in Al Hilal's healthcare. See, I have said it before also. In the vision statement of Al Hilal, it's written, delivering quality care through a dedicated, through a number of dedicated professionals and quality healthcare workers to the poorest of the community. It's included in the vision statement. So they want to be the people delivering care to the community with a set of qualified and dedicated healthcare professionals. So to include that in the vision statement, for me, it's a big sign that this particular institution is committed to the general public.
Thank you, Doctor. Thank you very much. So, viewers, I hope you got all the valuable information about oral cancer from the doctor. As doctor now mentioned, if you find any of the symptoms in your mouth, just through self-examination, go for medical intervention on time and lead a better life. So, till we meet again next time, this is Jessila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.